Cynthia here from Sin City Neuro MP. So if you don't already know, I'm a neurology nurse practitioner here in Las Vegas, Nevada. So I make short, simple little videos, kind of off the cuff because I don't write any scripts, I just talk. And I make short videos for short attention spans, like I have different learners. I'm a different learner. So my last video was on hyperreflexia. So today I just want to talk about hyporeflexia. So that's when you're going through and you're checking those reflexes and they're either absent, they don't have any reflexes, or they are just like really diminished, kind of hard to find. So what causes that? So, and I'm not going to go into the nitty gritty of what causes it, corticospinal tracts, and, you know, or, and, you know, and hyperreflexia. So I want to teach you what is the meat and potatoes, the things that you would need to know as a nurse practitioner, or as a nurse or PA or whatever role you're applying. So checking their reflexes, they have diminished reflexes or they're absent reflexes. And like I said in my hyperreflexia video, that alone really doesn't mean anything. They could have 0 reflexes and it could really mean nothing. I mean, you can have absent reflexes just, you know, advanced age, and you know, obesity, you know, just knee surgery, any number of things. Now, but in the correct clinical setting, it's important to know. So things that can cause hyporeflexia, so diminished reflexes. Peripheral neuropathies, so diabetic neuropathies, chemo, you know, induced neuropathies. Those types of things can cause diminished reflexes. Things like Guillain-Barre syndrome, acute inflammatory demyelinating polyneuropathies. So polyneuropathies cause diminished reflexes. Thiamine deficiency. So thiamine deficiency, so on the other end, we talked about B12 deficiency for hyperreflexia. On this end, thiamine deficiency can cause hyporeflexia. And these things can also cause weakness. So weakness in setting of decreased reflexes. It can even look like Guillain-Barre syndrome and it just be a thiamine deficiency. And thiamine deficiencies we also see in those gastric bypass patients, and we will also see them in patients with alcohol abuse disorders. So, so always, if you have a patient and you know that they drink alcohol on a regular basis, make sure to give them thiamine. So those types of things can cause you to have diminished reflexes. Now, those aren't the only things, but those are the things that I'm just going to kind of touch on, but that's hyporeflexia. So when we're doing hypo, we're thinking outside of the central nervous system, so those peripheral nerves. So, and this would be a lower motor neuron sign, so lower motor neuron. And then there's obviously like ALS, and ALS is kind of hard to pinpoint because ALS can't have either or, because that is motor neuron disease, meaning it encompasses both upper and lower motor neuron signs. So that's it for hyporeflexia. There's other things that can do it. When I make these videos, the things that I talk about, it's not all encompassing. I don't make an exhaustive list of things, okay? And also, like I said, I don't make scripts. I just off the cuff, okay? Sorry. All right, but if you have any questions, leave a comment or subscribe. I have like 1 subscriber, which is fine. I'm kind of a niche thing, so I didn't expect much.